answering that dental emergency call remotely. Welcome to Teledentistry.
I'm on a call. Yeah, just a sec. Okay, sorry about that.
To avoid this,
Sorry. No, I don't want it to sound scary for you. That's not my intention. Sorry.
or this, we're going to take a look at the SHARE approach. It's a good foundation of best practices for your dental telehealth encounters. It begins with S for setting and speech matter. Consider some simple guidance on camera angle, lighting, background, and sound. You know, you don't need to be a Hollywood director to get the basics right. What you say is of course important, but how you listen and focus on the patient is critical to the success of the call. It all makes a difference. Let's start with a call that's not ideal.
All right. Karen, is that you?
Yes. Hi.
Hi, it's Dr. Allen. How are you?
I'm good. Thank you. How are you?
Yikes, that looking up from below camera angle works well in monster movies, but not so good here. Is that a piece of paper covering part of the camera? So, to recap, camera angle, unprofessional. Lighting, inadequate. Background, cluttered and distracting. Sound, not bad, not great, but not bad. Let's take 2 on this.
Carolyn, thank you so much for requesting this visit today. I was just talking to my dental assistant, and it sounds like you've got some pain going on.
Wow, notice how much better this is? Camera is closer to eye level, and he's making eye contact by talking directly to the camera, which brings us to the H in the SHARE approach, which stands for hold eye contact by looking at the camera. The lighting is good. We can see his face, and it's very professional. Nothing in the background to distract us.
Have you ever done this before? Is this your first time having a teledental visit?
And the sound is nice and clear. Now, let's move on to the content.
I need to come up with a diagnosis. You could have symptomatic apical periodontitis, or you could have asymptomatic apical periodontitis, and I need to try to figure that out. It's a little bit hard for me kind of using this teledental technology.
Now imagine that you're a patient in some distress. The doctor speaks very quickly in medical terms that you're unlikely to know and appears distracted, as if your call is a pain in the...
I'll ask you some questions. We'll talk for a few minutes. And then after that, I might actually have you do a few things. So, kind of look in your mouth maybe a little bit with your camera. How does that all sound to you in terms of agenda?
Wow, that sounds really great.
So can you just tell me a little bit about what you're experiencing?
Yeah, I'm having this really terrible pain here.
Sounds like lower right.
Isn't this better? The doctor speaks a bit slower and more clearly and asks open-ended questions. This is the A of the SHARE approach. Ask open-ended questions. As a patient, you should feel like you're the focus of the visit, able to have your voice heard.
And I had just taken some Advil and it didn't help.
Gotcha. So it started a little while ago and Advil was helping for a while, and it sounds like now it's just kind of continuous and you really can't stand it anymore.
A patient that feels heard is more willing to provide the needed information to make a better diagnosis and partner with you to create a treatment plan according to their values and preferences. Remember, just as in office, but especially in a remote call, the patient's participation is key.
And we have a couple different options in terms of treating that.
The doctor is taking the time to explain the diagnosis and options. Again, making the patient feel appreciated.
Are you familiar with what a root canal is?
I am. Yes, I've had a root canal, unfortunately.
This is the R of the SHARE approach. Relationally share information. It's the iterative process of elicit, provide, elicit. Elicit what your patient knows. Provide information as the patient needs or wants. And then elicit the patient's reaction, understanding, and questions as you help them move forward.
So those are kind of our 3 options, but when you think about those 3 options, I wonder if one stands out to you more than another.
I think I'd really like to go the root canal option. I'd like to, keep my body parts.
Okay.
Let's check in one more time with that call that started out poorly and see how it ends.
Sorry. No, I don't want it to sound scary for you. That's not my intention. Sorry. I just have a lot going on right now too. So let me get you back to the front desk then so we can get you that appointment and we can just get you scheduled, okay?
Well, okay, we'll see.
All right.
Okay, thanks.
That was cringeworthy.
All right, Carolyn. So I think we have a really good plan that it sounds like fits, with what you want and your desires and your preferences. So thank you for having that conversation with me. Thank you for doing all the things that, I needed you to do to kind of help me understand.
I think this has been really great for me too. Thank you.
Totally. Well, we're here for you, and certainly teamwork,
Now that's how it's done. The E of the SHARE approach. Express warmth and gratitude. The patient felt listened to, and together they agreed on a plan that they both felt comfortable with.
For you, okay?
Okay, thank you so much.
In a remote video call, remember the SHARE approach as you position your camera as close to eye level as possible. Make it easy for yourself to speak directly into the camera and still see your patient at the same time. Position yourself or a light so that your face is lit. A soft, warm light source just off center is good, or an indirect natural light from outside is also good. Avoid a cluttered and distracting background or positioning yourself in front of a window with sunlight pouring in behind you. The bright light behind you will cause your camera to compensate for the light and darken your face. Find a quiet space and be close enough to the microphone to get clear sound. Consider an external microphone. Speak slowly, clearly, and avoid medical jargon. Ask open-ended questions that draw out your patient's story. Listen attentively, empathetically, and appreciatively. Make eye contact as you speak and as you listen. It's not difficult and it doesn't take long, but all these things can make a big difference.
All right. Thank you, Carolyn. I hope you have a great day. We'll see you soon.
Thank you too.